Hello and welcome to our weekly live stream. Well, it's currently not live streaming. We're just talking. This is a recording, but trust me, it's going to start being live streamed very, very soon. And we're talking about the laws of life. Hang on, and just make sure that everything is gallery. So gallery, which one? Is multi-speaker. Okay, okay. Just want to make sure that the setting is right. So, okay. Did you see an inversion just now?
No, I did not.
Okay, I was on the left. I was on the right side before. Now I'm on the left side.
Oh, no, you're above me.
Okay, that's your setting. Got it. Okay,
Yeah.
because somebody has complained before saying that they did not that when they were watching it, it was only showing one person at a time. So it would
Oh,
show me, then show you, then show me, and that's not what we want. We want both of us to be showing at the same time. Okay, all right. So I think I fixed it now. Okay, hi, welcome to our weekly show. Your it's hello, hello, and welcome to.
just take your time, start again. I was a theater arts major, so I know these things. So just cut and start, and you're going to crop it out anyway.
Right.
And I wouldn't worry about saying whether it's live or not. Just say, it's live because we were here live now.
That's right. We are live now. Okay. So I'll just forget. Thank you for that. Okay. Here. Hello and welcome to our weekly show, which of course is keeping your marbles. And this is for everyone who is concerned about the health of their brain, the health of their loved one's brain, basically what people need to know about how to keep their brains healthy and strong into their 90s and beyond if you choose to live that long. And a lot goes into this, by the way. And one of the things that I'm particularly concerned about is the what we call the invisible sufferer, or the invisible patient, sorry, the invisible patient or the secondary sufferer, as opposed to the primary sufferer who is going through dementia or already has dementia. And for many people or for many families, this is a shock to the system.
Yeah.
Many times people are totally disoriented when they get that first diagnosis. They don't know what to do. Maybe their finances are in disarray. They haven't planned for such a time like as this, and they're hearing advice from multiple sections, and they just don't know what to do. They're frozen. So I am particularly interested in helping these people, these loved ones, um, not only take care of their loved one who is going through the condition, but also take care of themselves. Because as we have said before, 30 to 42%, depending on who you ask, 30 to 42% of caregivers die before their loved one does. Now, that does not include those who develop medical conditions. That's those who actually predecease, who actually give up and die before their loved ones. There's a huge number of people who develop other chronic conditions. I have a friend personally whose father had dementia. His mother was taking care of him all the time, and soon after they lost him, she developed severe, very stage 3 or stage 4 cancer, and now she's having to deal with that. I guarantee you, taking the stress of taking care of her loved one had something to do with this. So we're going to go into this, and we have a wonderful guest today, Karina Loyo. I hope I pronounced that right. I know
You
we want to
did.
get. I did. Awesome. I got it.
Yes, you did.
Awesome. Well, thank you so much for making it today. I really value your input. We've had a few discussions. So tell us about yourself, and then we can get into our topic for today.
Well, I'll start with the topic. So you talked about dementia.
Yeah.
Where my story begins is I was a senior in high school, and we got the call from my grandfather who said, "Is there any way you all could move back here and help with your grandmother who had Alzheimer's?" Well, the family couldn't move back, but I was able to go and live with my grandparents. And sure enough, 3 months after I got there, my grandfather had a stroke. He was a caregiver. So
Mm.
you're right. I mean, caregivers end up with all this stress. And whether his stroke was related to being the invisible patient and having all the stress of caregiving to my grandmother, or whether it was just going to happen anyway. We'll never know. But we do know that caregiving is full of stress and that it does cause huge implications to the people who are taking care of their loved ones. So, 3 days after his stroke, I turned 19. So, I was a caregiver at a very early age. So, all of a sudden, I found myself with my grandmother who has Alzheimer's and my grandfather who is now wheelchair bound and has a speech impediment. So,
Mm,
that's where I started working with older adults and the whole aging process. And you're absolutely right. The caregiver has to be taken care of. They have to be recognized for everything that they're doing and what's going on inside of them. They really do become that invisible patient that we don't take
mhm.
care of and don't talk about often enough. So I'm really excited to be here having this conversation with you today.
Oh, that's fantastic. And I mean, it's you had to grow up really quickly at 19, apparently. Take care of two grandparents. I haven't heard that before.
Oh,
So,
it was definitely an experience. But when you're thrown in the middle of it, and that's what happens to all of us, right? We don't plan to be a caregiver, we're just thrown into it. Or in my case, I raised my hand and I said, hey, it gives me an opportunity to go live with my grandparents. I can have the college experience. No, I did not have that college experience, but I did have some amazing times as a caregiver to my grandparents, and I've got to know more about their life and be a part of those last 4 years. And so I wouldn't trade that for the world. But I made a lot of mistakes, and there was so much that I didn't know that I could have known that would have helped me. And that's one of the reasons why I am now dedicated to making sure that I spread the word on everything that I can to help the caregiver, to help the family members.
now, speaking of, you went back to college and you actually did studies that support what you're now trying to do to help caregivers. In addition, of course, to your breadwinning profession, which is real estate, right?
Well, no, so I did go through school all the way, got my doctorate. My doctorate is in health promotion and gerontology, so definitely all about the study of aging, longevity, program planning, implementation, and evaluation. So really trying to develop programs that can make a difference. And
Mhm.
so what I've done with older folks that I've worked with families for a really long time, I've also done some other career things, but predominantly across my whole career, it's been all about longevity and helping people live healthier, happier, longer lives. And so, with that, I've really focused now on ensuring that the caregivers are seen, that the caregivers have the tools that they need in order to be able to succeed. Because most of the time we're doing what we call the work, the life, the family, and the caregiving balance. So it isn't just work-life balance, which we talked about a lot in the early 2000s, right? I mean, that was a
Yeah.
really big thing. But now that we have this whole aging population, we're adding to it. So we're finding that our sandwich generation who has children at home is now having to balance their career, balance their kids, balance their spouse. They want to have a life too, and then they've got to be a caregiver on top of that. And that is really, really complicated.
Yeah.
And my personal story is yes, I started off at 18, 19 with my grandparents. We're with them for the last 4 years of their life. Spent a couple of years alone, got remarried. My first husband developed a chronic disorder. I spent 6 years with him, caregiving for him. I remarried after that and then ended up having my mother come live with me for the first 5 years of a 12-year caregiving experience with her. So, a caregiver as a granddaughter, as a wife, and as an adult child. So, I did all of it, right? It isn't just academic knowledge, which is what drives my passion and my empathy for anybody who's going through the process.
That's four times the caregiver. When we talked, you said three times. Now it's
No,
four
three
times.
times, three times.
Well, one of those times you were taking care of two at once.
Well, yeah, one of the, yeah,
Yeah,
as a granddaughter, yes, was two
the
people
granddaughter.
at once, yes.
And now this just to be clear, this is what's outside the country for your
No, that's
grandparents.
all here.
Or your grandparents were all here. Okay, got it.
So I grew up in Mexico City,
Okay,
but I moved to the States to help with my grandparents who lived here.
I see. Got it. Got it. Okay, okay, makes sense. And that's how you ended up in the States. Okay,
That's how I ended up back here, yes.
got it. Got it. Okay, so look into the mind of the caregiver based on your amazing experience. What is going on through, from what you've seen, not just in your experience, but in others? What's going on through their mind And how can we help them, those who are watching this right now?
Well, there is so much going on through people's minds, right? And it's hard to even explain the thought process and what is going on within them. But many of them are juggling so many things, right? I mean, they're juggling the responsibilities of their work because, they have to earn a living and they have to save for their own retirement. Many
Right.
of them are also paying for services and things that their elderly adults need. So with that, there's a huge financial strain and balance on that side. A lot of them have children, so then they're thinking, okay, what are the needs of my child, and do I need to be at a school activity? Do I need to get them to an after school activity? Am I giving them enough of my presence? Am I being there for them? And
Mhm.
then there's usually a spouse involved. Am I taking care of my spouse? Are they seeing enough of me? Is our relationship okay? Or am I using my spouse as my scapegoat? As
Mhm.
my, I've got to just let go of everything and I just go blah and tell him everything that's on my mind. And then there's the adult that you're taking care of who you may or may not have a good relationship with, who there's a whole history as to whether they were a good parent or an absent parent or whether they were alcoholic or whether they were perfect. But there's so many dynamics going on inside that it very, very quickly becomes overwhelming just because you have so many different things that you're juggling. Because even if we just look at the needs of the adult that has the caregiving needs, they may need, help with their home. They may need help paying their bills. They may need some medication management, and that's not easy because that's like making sure that all the medications are there, that if one is prescribed, it's added to the list. If it's unprescribed, taken off the list, asking the questions as to do we really need to be taking 14 medications or can we pare this down? Being their advocate in front of healthcare providers and making sure that they're getting the services that they need. Sometimes it's reviewing annually. Do I have the right Medicare package for them? Do I need any supplemental insurance? So all of a sudden, you have to become an insurance agent as well. And then you also have to know about finances. And some parents want you to know, and some parents don't want you to know. And you may or may not have control over this. And then there's also the challenge of knowing when and how much help to give. And then
Mhm.
there's the other side that we don't talk about. We get angry, we get resentful, we feel guilty for being angry because we have to take our free time to do this
Right.
and give care to this person that we absolutely love. And we want to help them because we love them. But at the same time, we'd rather be doing something else, or maybe we have to be doing something else. And there's that challenge between do I go to my girl's performance or do I, go to the grocery store and pick up something extra that my mother needs? And so there's
Right.
all this struggle, all this time, and all these emotions that come up. And many times it just is this unending internal conversation, and it becomes
Mhm.
so overwhelming so quickly. And we're just not talking about that part. And this whole guilt and anger cycle and wanting to help, it all kind of spirals and folds back upon each other. It's kind of like a bowl of spaghetti touching in all these different places. And it is
Mhm.
so challenging to just stop and take a breath and say, you know what? I can only do the best I can during whatever short amount of time I have. Because I don't have endless amount of time and I have to divvy that time up into different things, into my life, into my family, into my caregiving for my older adult. But we want and seek perfection because we love them and we want to be there. We want to be there and provide the best of us that we can. And that's in conflict with everything else that we have to do. And so these are the struggles that we're facing every day as caregivers.
Plus the loss of that relationship, right?
Yes.
So you're
Yeah.
grieving that as well, right? The mother,
Yes.
the father you used to love is no longer there for the most part.
Well, and it's worse than that because we have this image that we created of our parents when we were kids, right? Our
Mhm.
parents were like, for most of us, were like, they were amazing people. They were our role models. They were our, we'll call it a hero image of who our parents were. So no matter what our parents did, we always ended up developing this image of they're our hero. They're this amazing person and they've accomplished all these things and they mean this much to us. And then all of a sudden, we start seeing that they start to become fragile, that they're slowing down, maybe they're slumping over. And all of these things are things that we try to look at them with rose-colored glasses because we don't want to see that. That's not our parent. That's not who they were. They were a social butterfly. They were, in the case of my grandmother, she was like Miss San Marcos, Texas. Everybody knew who my grandmother was. She was a historian and she was a writer, and she was just an amazing person. And then all of a sudden, she can't hold a conversation. She sits and waits for you to pick up your fork so that she knows what fork to pick up, you know? And coming to terms with that shift and that change, there's anticipatory grieving. There's grief that happens every step of the way.
Yeah.
And we also grieve the fact that we're losing them, but yet we've already lost them. And it's just this weird struggle because they aren't the person that we thought they would be, or that we imagined that they were, or that they really were at one time. They just aren't anymore.
Yeah. Yeah.
Yeah.
So there's so many things going on
Yes.
through those minds.
Hmm.
How do we help such a person?
Well, I think the first thing is we have to realize what truly is happening, right? We do need to take off the rose-colored glasses and say, I know I love my mom or dad. I know I have a hero image of them, but I have to be realistic about what's going on.
Mhm.
And I have to do it in such a way that I'm not coming in and taking over their life when I don't need to be taking over their life, right? Because many times there will be an instance, like for example, with older women, a urinary tract infection can cause them to have all sorts of symptoms and can cause them to get brain fog and slow down and uh, just have all sorts of symptoms that make you feel like, gosh, they really, really are suddenly declining. Well, they have an infection. And if we take care of that infection quickly, then it won't uh, have a permanent effect. But if we don't take care of it, it can progress and can get much worse. So many times, what will happen is there's that instant like that, and then the family member freaks out and wants to do everything and wants to move them into an assisted living community. I'm like, well,
Mhm.
no, all they really needed was temporary help for a few days while the antibiotics kicked in, maybe some catching up with the housework and house maintenance. And after that, they're probably good to go for several months or even years.
Mm.
But many times, the adult child who lives in another state gets stressed out over the fact that they can't control the situation and they want what's best for their loved one. And so they come in and they try to impose their will. You need to stop driving. You need to move to a different home. You need to have a caregiver. Well, I mean, when our parents came in and tried to tell us how to mother or father our children, we didn't like that. We didn't
Yeah.
like it when they tried to tell us what to do when we were teenagers. What makes us think that they would like to be treated that way any more than we did? They
Right.
don't. We have to
Right.
respect them. We have to start with making sure that it's their choice, that together we are working on this. I hear the parenting your parent. No, your parents had parents. You don't need to parent them. They're adults. You're partnering with your parent on this phase of their life. And as
Right.
a partner, you will be amazing. But if you try to parent them, I think that's our first mistake. Because when we try to parent, we try to take control of everything. And we don't need to take control of everything.
And they kick back.
Eventually,
Thanks.
Unknown caller.
Oops.
yeah, eventually we will need to help take care of them. If they have Alzheimer's or some other type of dementia, yes, we will definitely need to take care and take control over the situation. But in the beginning stages, there's so much that they can do. And we need to honor that. And we need to give them the opportunity to make choices and to do as much as they can for themselves. Because that's part of us also being able to balance the workload of being a caregiver.
Yes. So some of the things too, I mean, it's very important that people be aware of what's going on, especially like you mentioned with the UTI.
Hmm.
Sometimes they may not know there's a UTI going on at all, and they might need to.
That's right. And you know that better than I do, that as you get older, people have different symptoms. So
Yeah.
the symptoms that a young person like myself would typically have with a UTI, they don't exist. I had one lady that I worked with, and every time I would go see her, I would, kind of pay attention to how she spoke, how she walked, just kind of the energy around her. And I got to the point where I could tell that she had UTIs. She
Mhm.
never had any symptoms, not a single symptom at all. And I could just tell, I'd be like, hey, I think let's go get a test from downstairs and check and make sure you don't have a UTI. And every single time she had one.
Wow.
They happen a lot as we get older and they don't come with pain. And most people don't realize it until they see blood in the urine. That's the first sign that they have a UTI. And by then, it's gone way too far.
Oh my God, of course, of
Yeah.
course. So children of aged parents should
Hmm.
be very aware, especially grandmothers or mothers. Uh, because they are more prone to having UTIs. So is that what you're saying, that they should be always on the lookout for?
They should. They should be on the lookout for different symptoms, right? You can
Right,
see that suddenly they're a little bit slower.
right.
Suddenly it takes them a little bit longer to answer. It's kind of like really subtle things. But yeah, being on the lookout to if it suddenly feels like they're a little confused or a little low energy, or maybe the only thing that they feel is that they don't quite feel like themselves anymore, then
Mhm.
that's the point in which you need to say, well, maybe it's a UTI. And with this particular person, I can tell you that at one point in time, she went to the emergency room 3 times before they actually figured out it was a UTI. They had all sorts of MRIs, CT scans, heart tests, everything, sent her home over a period of 3 weeks, and then finally came back and realized that the diagnosis was a UTI. Had they caught it right away, she wouldn't have had to end up 4 months in assisted living. She
Oh
would
my
have been
God.
able to go right back to her home. How do I know that? Because after those 4 months in assisted living, she came back to her home. And that's when I really started paying attention to her and her symptoms. And so we were able to get those UTIs caught within a couple of days and then treated. And she lived in her home for the next 2 years with no problems.
Wow. What happened after then?
Yeah.
What happened after the next 2 years?
After the next 2 years, she ended up having a kidney infection and developed cancer and eventually passed.
Mm.
Yeah.
Okay. She had lost her husband. She didn't have a husband at that time?
Yeah, when I met her, she had lost her husband. I worked with her for a little bit over a decade.
Okay.
Yeah.
Okay. So yeah, I think this is great information. People
Hmm.
need to always be aware of the UTI, of the possibility of a UTI.
Yeah.
I also, one of the things that I talk to about to caregivers, uh, is that you should make sure that your mother, or your father, your grandparent is having the right nutrients. Now, what we know obviously is that as you grow older, and you know this, Karina, as much as anybody, that as you grow older, your appetite reduces. And even if
Hmm.
your appetite is normal, the digestive enzymes, your digestive tract is not as robust and it used to be. So it's not able to digest and break down foods and absorb them and then use the amino acids, the proteins, the fatty
Hmm.
acids, all the nutrients, the vitamins, the minerals, all the essential nutrients that your brain and body must have. That ability to get them into where they need to go, whether it's the brain or the kidneys or whatever it is diminished. So I am a very, very firm believer and a strong advocate for basic nutrient
Hmm.
supplements, not just for the elderly person, but also for the caregiver. Uh,
Yes.
so I have what I known as my non-negotiables. Like for instance, I talk about potassium. I mean, most older adults are deficient in potassium, and magnesium, of course, is important. And vitamin D, which has the most research
Right.
in terms of what that can help to prevent or lower the risk of dementia. I mean, now apparently there's a war on vitamin D, and I don't know why that is so. But there was a recent study by the Alzheimer's Association showing that those who supplement can reduce their risk of dementia by 40%. And this is increased in women in particular by up to 50%. You can reduce your risk if you take supplements. So I think these are easy wins to help those who are not just living with some kind of disability or living with decreased, diminished mental function.
Right.
Let's say not dementia, but also the caregivers themselves. Since we're talking about caregivers,
Yeah.
caregivers need to have the nutrient supports because again, with all the things you're talking about, they're going through a lot of stress. They're
Yeah.
tired. They're first of all, they're not going to be eating well. They probably are
Right.
not going to be sleeping well. And all of
Mm-hmm.
these, they're probably going to be on medications for antidepressant because of the depression they're going through. So they're going through a
Maybe.
lot. And these things are tasking their bodies and
Yeah.
taking away and depriving them of nutrients. So to me,
It,
it's a no-brainer that we
right.
give them that they should be aware you need to be taking the right nutrients to support your brain and body while you're going through this process. Otherwise, like we said at the beginning, you will be deprived of these, and you will suffer the consequences, unfortunately, of
Right.
not being proactive enough to take care of
Mm-hmm.
these things.
I absolutely agree. For me, a non-negotiable is also making sure that you're consuming enough protein. So,
Yes.
unfortunately, my age group, and some of the others, grew up in a society of dieting and starving your body to get to the perfect image. And as such, we looked at calorie restriction. Well, with proteins being higher and denser in calories, that was one of the first things that people were cutting out. And
Mhm.
what happens is if we cut out the protein, then we don't have the building blocks for muscles. And if you don't have the building blocks to maintain muscle, you're going to end up losing muscle mass. Well, lose muscle mass means your metabolism slows down. That's
Yes.
why we're having all these issues with people who say, oh, well, I hit 50 and now I can't lose weight. Look at everything I'm gaining. Well,
Yeah.
you're not eating enough protein. That's the problem.
Yes.
And when we look at the studies about sarcopenia, the muscle mass loss that happens with
Mhm.
aging, we can see it starts even in people's 30s. So I
Mhm.
agree completely with you. We need to have the right supplements and we need to have enough protein and then also the weight bearing exercises. Those are the three key things that if you do nothing else, I believe will really help you overall age better and save your brain.
I'm so glad you said that, especially yeah, these three, especially for women. Now,
Mhm.
let me ask you this: what are your go-to protein sources?
Well, I tell people to grab their favorite protein shake at a minimum. Now, of course, I prefer for them to do natural protein sources, right? Like meat or even some plants that have higher concentration of protein. But the reality of our American society and lifestyle is that most of us don't understand how we can get enough protein. And so, getting at least one protein shake that has 25 to 30 grams a day is going to help ensure that you got at least a third of what it is that you need every day. And especially for women, excuse me, that are skipping breakfast,
Mm.
that's going to be the most important thing for them to do. Have that protein shake for breakfast. It transforms your life. It also, when you look at the action of insulin in the body throughout the day, having that protein for breakfast, whether it's a protein shake, yogurts are very high in protein. Some of them, you just got to make sure that they're low in sugar.
Yeah.
Yeah, right. I mean, you have to balance it, right?
Yes.
And so, but making sure that you have protein to begin your day is an excellent way to help control the cravings all day long. In
Mm.
fact, I've done many times I will tell people, look, you need to eat protein with every meal. And somebody will tell me, well, I get all these cravings all day long and I just want sugar. I'm like, fine, feed that sugar craving, but here's the rule. You have to eat protein with it. Well, what do you
Okay.
mean? Well, beef jerky, chicken, meat, some protein with it, peanut butter, nuts. I don't really care, but you have to have some protein with it. Because if
Mm.
you will do protein with your sugar craving, in 3 days, you will all of a sudden not have any cravings because
Mm.
you've rebalanced your insulin level in your body. It- it's just amazing if we just know a little bit about how it all works. But most
Right.
people don't talk about how it works. They just tell us, don't eat this, right? And I've always thought that every time you tell somebody don't do something, that's the first thing they want to do.
Think about
And as soon as they do it, then they feel like, oh my God, I just cheated on that diet. I lost. I can't do this, right?
they
And
give up.
right, they give up. And
Yeah,
that's not what it's about. What it's about is instead, see how I didn't say don't eat the sugar. I said that's fine, but you have to eat protein with it.
yeah,
Because I know, and I tell them if you do it within 3 days, you won't have any cravings. And most of them laugh and tell me that I'm crazy, but they always come back and tell me, oh my gosh, I've been without cravings for 3 days. I'm
that's
like,
amazing.
that's because you're eating protein multiple times a day. And if you were to just eat protein, with any carbohydrate that you have, it will help rebalance that insulin because that's the key.
That's
Science
amazing.
tells us that's the key. We just don't really tell people how to practice it. So the way we practice is eat protein with every meal, eat protein with every snack.
Well, there seems to be a war against protein. I mean,
Oh,
there are different groups
yeah.
and factions saying, "Oh, well, it's dangerous. You can have cancer." Especially, I mean, I don't know if you know how much you know about the carnivore diet, and I have my questions about it too. But I gotta tell you, they're getting some things right, especially when it comes to proteins and healthy fats, because
Yes.
I, I am amazed at many of the turnarounds in terms of health, chronic diseases for people who have gone on a carnivore diet. So,
Hmm.
but they're getting the protein right. I truly believe that most people, especially those of us in our 50s and above, are not getting enough protein
I
on
agree.
on
And
average.
that's why we see our older folks, some of them losing muscle mass. And that when you lose muscle mass, you sag. So
Yeah,
if you want to be a healthier older person, you have to eat enough protein. You have to have a balanced diet. I mean, you can't eat huge amounts of excess or it's going to show up in adipose tissue or fat. We don't want that. But we do want to maintain our muscle mass. And to maintain muscle mass, enough protein, enough exercise. If we do it right, we're eating it at multiple times a day. We don't eat carbohydrates without protein. We're going to have steady insulin levels, and that's going to have an impact on whether or not we get diabetes, or if we have it, maybe regulating it better. And as a caregiver, being able to maintain your sense of balance because your body's getting the fuel that it needs and staying healthy and strong will allow you to be able to help your older adult maybe with transfers. Although I would say only do it if you know that you're doing it the right way and that you're strong enough to do it by yourself, or you've got to get somebody to help you. Because one thing you don't want to do is you don't want to get injured as a caregiver.
yeah,
Because then
for sure.
if you injure your back, that affects you for the rest of your life.
For
So you
sure.
have to be able to have a balance between what your loved one needs, what you're able and willing to do, because you have to keep in mind that at the end of the day, it's your life too.
Yep,
And
yep,
that's important. But
for
yeah,
sure.
with older folks, they need to have enough protein. There's studies that they've done with older adults where some of them have gotten the exercise plus protein, others have just gotten the protein. And what they found is that either one of them builds muscle mass. You do build more muscle mass when you're doing the weightlifting or endurance type of exercises. So that's, really good. And metabolism goes up the more muscle mass you have.
That's very important. Yes, and I like what you said also about some of the more basic things. Strength training, especially for the ladies, again, leg strength training. I believe at a bare minimum, elderly ladies should be able to sit and stand from the seated position unaided. They need to be
Yes,
trained to be able to do that multiple times a day and not have to get support. Because
correct.
once there's a fall or once there's a fracture, that could be it for a lot of people, a lot of
Right.
women. What is the stats now? About 30% who have a fracture will die within the next year.
Within 30 days.
Is it 30, 30?
Yeah, it's okay. So 10% will die within 30 days, 30% will die within a year, and another 30% within 2 years. Yeah, no, the statistics are crazy. 60% of falls happen within the home. Yeah, yeah, you just hit kind of one of my passion points. So speaking of that, and speaking of the ability to get up out of the chair.
Yeah,
So because of the people that I work with, sometimes they're people who have not exercised in a long time. So
yeah.
they're like, I'm huffing and puffing by the time I hit 5 minutes. There's no way I could exercise. I'm like, oh, absolutely. Have you not heard of micro exercising? They're like, what's that? I said, well, you get up out of your chair, right? They're like, well, yeah. I said, okay, well, sit back down, get back up, sit back down, get back up. Do that 3 to 5 times every time that you stand up or sit down. Now, what happens? Most people get up out of their chair 20 or more times a day. So if you do three up and down, every time for 20 times a day, you just did 60 squats onto your chair. That's a
Mm,
lot of exercise for somebody that has not been exercising.
yeah.
And that really helps keep the ability to get up and out of the chair. But more importantly than that is that as we get older, if we sit for a while, it takes our brain and heart a moment to know that we've actually gotten up to move. And so what ends up happening is we get up, we start moving, we feel that faint, everything goes black, and some of us hit the floor, and that's how we fall and break a hip.
Mm,
Others are able to get themselves steadied enough or sit back down in their chair if they haven't gotten too far. But if you do that up and down 3 times, then you've given your body enough time to say, okay, I know what we're doing, we're moving. And if you do get that faint spell, you're still holding onto the chair, you're still within reach to just sit back down quickly instead of falling onto the ground and breaking something. And so I highly recommend that anybody over the age of 50 start doing this as a micro exercise anytime that they can, because it will strengthen them. It will help them avoid a fall due to this uh, situation with the way our brain and body works after we've been sitting for a while.
mm,
And also because overall, it is going to improve your strength and ability to continue moving.
yes.
The other thing that I recommend sometimes is before you actually do that, just move your feet up and down. Just, tap your toes a few times. Even if you just get into the habit of doing that, that can help you avoid a fall.
Mm-hmm, mm-hmm.
Mhm.
Movement is so, so important, whether it's micro movement, like you said,
Yes.
or physical movement. I love that.
Yeah.
All right. So let's talk a little bit more now about caregivers, what they can, how they can take care of themselves. We talk about protein, we talk about supplements. There's
Yeah.
still a huge amount. By the way, I just want to say this real quick. For those people who are dealing with cravings, obviously sweet dessert cravings, carbohydrate, here's a tip: magnesium, magnesium supplement, magnesium glycinate probably would be the best one. Has been shown to blunt sugar cravings in adults if you have enough magnesium in your body, and this is a very safe nutrient. Most people are not getting enough, as in a lot of other things. So magnesium supplementation can help
Hmm.
blunt cravings, as well as,
Yes.
of course, taking protein and eating protein along with the sugar you have.
Yeah. And my tip too is I have to take calcium supplements.
Okay.
And so a lot of times the way I will take them is in an antacid, right? And some of them have flavor to them. And so sometimes I will wait until I get a craving, and that's when I will take my little calcium supplement because it just has a tiny bit of that different flavor. Either that or I will do things like squeeze a lemon into the water that I'm drinking or do some fruit infused water. That way you get some flavor, which still gives you that, oh, tiny sweetness, and that
Yeah.
doesn't make you feel deprived. So, there are so many different ways. And, the other thing is a lot of caregivers say, well, I just don't have time to plan out good meals and take care of myself nutritionally. I'm like, well, wait a second. Aren't you planning meals for your loved one? Aren't you cooking for your loved one? Why are you cooking something for you at home and for something different for your loved one at their house? No, just make one meal plan that everybody can eat that's much more nutritious.
Hmm.
And years ago, I used to work at the city of Austin. I used to teach a class on, improving your nutrition.
Hmm.
And here's the reality. The majority of us eat about the same 20, 30 meals and we rotate them around and we may add slightly different spices and stuff like that. So my recommendation at that point in time, and it continues to be my recommendation today, is for the next week or 2 weeks, every time you eat, grab one note card and write a meal on each one of those note cards. And whatever it is that you eat, just write it down the way that it is. And then the second week, what you're going to do is you're going to actually take each one of those and you're going to look at it. You're going to say, okay, how can I make that healthier? And I use the plate method of eating, right? So you would look at it and we say, okay, how does that meal that I ate fit into the plate method? And the plate method being, half of your plate is vegetables, one quarter of it's protein, one quarter of it is complex grains. And then you have a couple of servings of fruit off to the side and milk as well. And so when you look at your card again and you say, oh, well, it doesn't have any vegetables or it's very high in protein and carbs with no veggies. So then you add vegetables that your family does like to that. So you rewrite the card in a healthier way. So you're just substituting what you normally eat, you're adding to it and substituting more of whatever was missing. And so slowly you develop a new deck of cards of this is what I typically eat, but now it's enhanced and healthier for you and healthier for your family. And then, maybe in week two, you decide, well, today I'm making something totally new that I haven't had, in last week's card. That's okay. Make it like you normally would, write it down, and then make that into the right kind of balance according to the plate method. And then you will now have a better meal option the next time that you need to do some meal planning. Does that make sense?
Yeah, yeah, yeah. People have to make their mind up to do it though. To
They
remember to get
they
those cuts.
They do, but this method of doing note cards and then revising the note cards tends to be the simplest way to do it because then when it comes to menu planning, you can take the cards, just lay them out on the table, and then decide, okay, pick the ones you want for Monday, Tuesday, Wednesday, Thursday, Friday, so on, and just put them for lunch and dinner. And you have a plan for the whole week, and it makes it so much easier. So, a little bit of work for a week or two, and then all of a sudden, meal planning becomes really easy.
Makes sense. Makes sense.
Mhm.
Good point. I also still want to say that even with all the planning, we need to remember to take supplements as well because the food
Yes.
is not going to provide you with all those unfortunate things. That it just isn't. Food isn't what it used to be before. So
Yeah.
yes, the food. But I was going to ask you too. But sometimes the loved one who has the dementia or is dealing with the disability is not going to want to eat certain kinds of foods. So does that mean you are forced to eat, the caregiver has to eat what the loved one is eating?
No, not necessarily. I mean, you can look and see what it is that they would eat, right? So maybe they eat part of the meal, but they don't eat all of the meal.
Mhm.
Or maybe, let's say, for example, you look at the base items. So let's say that your loved one will eat chicken, but they only eat chicken plain. Like I do this all the time. I have twins. I have one that is a textured version and eats really plain. So I will cook chicken and then I will take part of the chicken that has no spices and set it aside because that's all that one will eat. And
Yeah,
then the next one will eat a little bit more, but not as much as my husband and I will. And so I will take, after I season it, I'll take another portion out for her, and then I will finish making the enchiladas, which is what my husband and I wanted to have that day, for example. And
okay.
they will get some other combination of stuff with their food.
Got it.
So,
Okay.
so
All
it's
right.
just about thinking of it more strategically, kind of like building blocks of things.
Yeah. Okay. Great. Thank you for that. So let's go back again to the caregivers now.
Yes.
We've talked about diet. We've talked about some sort of exercise that they should be doing, move as much as possible.
Yes.
We haven't talked about sleep, I think, and I think that that
Uh,
is very important too. What do you have on that?
So for sleep, I think it's going to have to vary depending on what things you're able to do and what advancement your family member has on the dementia side. So let me explain that a little bit. So obviously in the early stages of dementia, it's relatively easy to, take care of them. Just you can do things like if they need to stay in their room or you need to know if they come out of the room, there are some devices that you can get where basically you tape them to each side of the door, and when they lose contact, it's going to ring a bell. So it's basically like a doorbell kind of, or a chime, like a security chime. You
Okay.
can use something like that so that you can be woken up and know, oh, they've left the room, something's wrong. There are also pressure pads that can be put underneath people to let you know if they're attempting to get up out of bed. So there are devices that will help you alert you to when your loved one is trying to do something that could endanger them. So, depending on the level of what it is that they're currently in, the state, you can talk to your physician about what devices, what things can we do so that I can actually sleep but be woken up if something happens, right? Or if before they are going to have a potential instance.
Okay.
Okay. So that's on the extreme end. But on the front end, there are routines and things that people can do to sleep better. Making sure that the room is comfortable, that it is the right temperature, making sure that the room is a cozy and inviting place that really does invite you to sleep. And you do things like they call it technology hygiene. So keep your cell phone and your TVs out of the bedroom so that you can actually really just lay down to sleep.
Uh,
Because that has been shown to be the best way to do it. It's okay to be on your telephone beforehand, just do it in a chair in a different part of your house so that when it's time for you to put your phone away, brush your teeth, do whatever else you do to go to bed, then you're away from that blue light from the telephone and you can get away from that kind of always having to make micro decisions because your phone is constantly dinging you.
right,
Another,
right.
yeah, and another thing that you can do is really the best time to take a shower is in the evening so that you can wash off everything from the daytime, right? Any allergens that you might have picked up on your skin, all the sweat and all that kind of stuff. And that
Yeah,
act of physically taking a bath has a relaxation effect on it. It also uses up, a little bit more time. It calms you down. Having a cup of tea can also be relaxing. So thinking about what types of things can help you recenter with yourself, even do some meditation or some breathing or writing in a gratitude journal. All of those are different types of activities that can help you recenter yourself and get you ready for bed because that sleep is going to be really, really important.
yes, yes. That's really great. But my experience with a lot of women, and since more women are the majority of the caregivers, is that even before they had this issue with a loved one, who has dementia, they already had problems sleeping. Even with
Yes, we do. Thank you,
so
menopause.
so yeah, I mean, having a controlled environment is great and keeping the phone away. But even if everything is perfect, they've had their shower, they've brushed their teeth, and they lie down in their bed, sometimes that sleep doesn't come in, and I think doesn't come. And then when you compound that with dealing with the stressful care of someone, a loved one, that even worsens what was already a bad situation in the first place. So I think we need a little bit more than that. I mean, I think we really need to aggressively, because in my opinion, if if women who are already having trouble sleeping and they have now have a loved one who puts a greater burden and a greater hindrance to their sleeping
Mhm.
well comes into
Yeah,
becomes part of the picture, then they're not gonna sleep well, and
right.
that's going to set
And
them up for problems.
yeah, and one of the issues that happens is when we do lay down to sleep, sometimes that's the moment where our brain all of a sudden goes into overdrive, right? And it starts thinking about all the things and all the worst case scenarios and the could have, should have, would have. And so if that happens, my suggestion is get up out of bed, go sit down somewhere where you can write or do something calming, like maybe it's reading a book, maybe it's they have something called diamond painting now. It's like paint by numbers but with little diamond chips, or any kind of adult coloring book is also a good way to kind of meditate, relax. If you like to crochet, crocheting, especially when you're counting, is kind of meditative. So those types of things can help you get into that mode of rest because one of the things that we know is even if we get into more of that meditative state, that allows our body to rest, even though our mind may not be resting as much as it could as if it were sleeping, but we still get a body benefit from that rest. And then as our we start to calm down and our nervous system starts to slow down, then we can go back to bed. And for those of you that wake up in the middle of the night, it used to be that we had something called second sleep. So it used to be that in the days of the agrarian society, People would go to bed when the sun went down, and then they would wake somewhere around midnight, 1 o'clock in the morning, and they'd be awake till 2 or 3 o'clock in the morning, so a couple of hours in between there. But then they would go back to sleep, and usually
Yeah,
during that time,
that is
what?
happening. That's not
What?
that doesn't happen
No,
anymore.
it's not viable, but it was the way that it used to be.
I
So
understand.
so if what the message on that is, if you happen to be one of those people that wakes up, the worst thing that you can do is sit there and toss and turn and get angry because your head won't stop. Instead, it's much better to get up, get a glass of water, or, you know, sit down with a book, do something, and then come back,
Yeah,
right? Because you don't want, if you start that spiraling in your head, then now you've engaged emotions. Now you're feeling way too many things, and being able to break that cycle and get back to sleep,
yeah.
it almost can't be done. I will put on a lot of music. I like the healing frequency music just because I like it. And so that's what I will put on. And I'll close my eyes and try that for 15 minutes. And most of the time, that's all I need to go back to sleep. But sometimes, if I can't, I will get up and I will do something else. And then I'll come back 30 minutes later and then I'll go back to sleep. But if I just stay in bed and try to go back to sleep, it'll be 2 hours before I'm back at sleep.
Yeah, yeah. Well, so okay, those are great tips.
Yeah.
I hope people can follow them. Uh, most of my patients have more severe problems than that, unfortunately, and I have to address it from a biological perspective. Um, for example, vitamin D deficiency. I know I talk about that a lot.
Yeah.
Has been linked to sleep problems,
Hmm.
and since most of my patients are black, black people tend to have less vitamin D, greater vitamin D deficiency than other races. So that's one of the things I always look out for. I mean, if your vitamin D levels are low, there's there's very little techniques or arrangement you can do to
Yeah.
get good sleep. Doesn't matter what you do, whether it's painting or thinking or
Hmm.
writing or whatever it is, or singing or music. You need that biological, that biochemical issue is there, and it has to be
Yeah.
addressed.
So, a question on that. I've heard that K2 should also be taken with the vitamin D3 to be able to help it absorb better. And I've also heard that maybe there's some vitamins you don't want to take at the same time that you do the vitamin D3. Can you talk about that a little bit?
Yeah, sure. I prefer not to overcomplicate things, but I definitely agree. And I would recommend this that K2 and D3 should be taken
Hmm.
together. The reason for it is not to help it absorb, but is to counteract the effect of high calcium in the body, which is what
Okay.
vitamin D does. Vitamin D does a lot of good things. It helps the brain, it helps the cardiovascular system, it helps the immune system, but it also increases the absorption of calcium from the digestive system. So that can raise calcium levels in the blood. What K2 does is that K2 takes that calcium and drives it into the bones and the teeth where it is needed, and not in the linings of the blood vessels, which tends to happen if there's too much calcium in the blood.
Okay.
That is a risk factor, but it is not as big a risk factor as people are concerned about. Now, again, because I come from a culture and a country where these vitamins are just beginning to get into circulation, people don't can't get a D3K2 combination. I've had people ask in Nigeria, where I'm from, I've had people I've told people to get D3K2, and they'll look everywhere and they come back to me and they say they don't have it. So I have to buy it here and then ship it to Nigeria. However, they can get D3 anywhere in most shops, most stores. So I say, well, so I have a decision to make. Do I just say get D3 and K2 only and don't try anything else, or tell them get D3?
Yeah.
And obviously, the obvious thing is get D3.
Right. Get D3.
Get D3 wherever you can get it, and then we can deal with the consequences later. But most people are very deficient in D3. So,
I agree.
so if they correct that deficiency, it's pretty much the side effects of having higher calcium is negligible compared to the downside of having too little vitamin D3.
Yeah.
So that's the point. And that's not the only
Well,
thing too. I mean, I also talk about, so some of my patients, I have give them melatonin, which is becoming
uh-huh.
a superstar. I mean, some people, it works with
Yes.
some people, it doesn't work with other people, I understand. But their magnesium too it can be
Mm-hmm.
helpful. And even vitamin C, believe it or not, powder
Really?
now, not the capsules, but you can take vitamin C powder, mix it with water. For some people, it helps them sleep better. So there are different things. And I really want to aggressively, because where caregivers are concerned, you've got, if you have 4 hours sleep, if you have 8 hours of sleep, it has to count, because for the rest of the
Yes.
day, when you're awake, you're busy and you're taking care of your loved one and all that. So those few hours that you get, you've got to maximize them. And you've got to get some kind of deep sleep, some few hours of deep sleep out of the however long amount of sleep you have. The deep sleep is the most important aspect. And so,
Right.
again, women tend to overlook that. They just tend to see it as not important, and I think that's a big mistake.
No, I totally agree, and I definitely agree that vitamin D3 and preferably with the K2 and then magnesium tend to be the things that most of us as women, well, also calcium that we don't get enough of.
Yeah, true.
Yeah.
Now, again, calcium is a bit of a, if it's clear the individual, especially woman, is deficient in calcium, then it's good supplement, but not on a long-term basis.
Mm-hmm.
Because the danger is that and there's a much higher risk of having too much calcium if you're taking calcium supplements. In fact, there are some cardiovascular uh, cardiologists who will absolutely not recommend calcium supplements. They're going to recommend calcium foods or tell you to increase your vitamin D levels to raise your calcium levels. But calcium supplements may have a problem because taking them can increase calcium buildup in the lining of the blood vessels, and we don't want that.
Yeah, we definitely don't want that.
Yeah, yeah,
Yeah.
yeah. Oh wow! So we've had a lot, great discussion. I mean, we've. I thought we were going to do for about 30 minutes. We've done a whole hour. So this has been just to show how interesting this conversation has been.
Well, thank you. It has flown by. Honestly, there's just so much to talk about when it comes to
There is,
caregivers. It really
there
is.
is. There is. Well, we definitely have to have you back so we can delve into some more targeted issues, more specific areas that can help these people. We can help people who have loved ones and they're wondering what to do. Like one thing I forgot we probably have to we didn't mention, but really that interaction with the doctor or the healthcare provider during the
Yeah.
maybe once in 6 month visits if the patient has dementia, where you have only 15 minutes with the doctor. How do you
Yes.
make it work? How do you get
Yeah.
through taking, you mentioned this briefly, how does you get the doctor to look through the current medication profile and decide what to take out and what to leave in, right? So that they
Right.
aren't taking the wrong medications over and over again. Because many times these doctors they don't even talk to themselves many times.
No. Yeah, we should have a whole conversation just about that because we could talk over an hour just on that one topic, how to advocate for your loved one in a medical appointment. I think that would be a great conversation.
Great. All right, we'll pen that down and then we'll get a time to do that. How's that?
That sounds great. Yes.
Well, Karina, thank you so much for your time today. This has been great information, and we will look forward to having you back soon.
Thank you. You're welcome. I really appreciated being a part of this, and I hope that people learned something new. I'm sure they did.
I'm sure they did. I'm sure they did. All right, you take care. Have a good one,
Thank you. You too.
and bye, folks. Thanks for joining us. Remember to join us next week. Bye. All right, so I'm just going to pause this so that we can get
Yes.
to our discussion. Stop recording. I think that's what I need to do.